Okay, good morning. My name is Hon Shing. I'm a consultant in the cornea and refractive surgery department. And you've just heard some talks on cataracts, glaucoma, and retinal diseases. Then I will now focus on a common symptom that many of you would probably have experienced it at some point in your life. The symptoms is red eyes. And the topic of my talk is my eyes are red. Is it serious? So why is this topic relevant? Well, red eye is one of the commonest eye symptom why people attend the accident emergency department. 80% of patients presenting with eye problems to A&E have a red eye. So red eye is one of the commonest eye symptoms why people attend the accident emergency department, and 80% of patients presenting with eye problems to the A&E have a red eye. So this topic is very relevant. So before we talk about red eyes and understand the different diseases that can cause red eyes, it's important to understand some of the important structures of the eyes which can account for eye redness. And this is a simplified cross-sectional model of the eye. We've seen this in the previous talks. So the majority of the causes of red eyes are due to problems in the front structures of the eye. So majority of causes of red eyes are due to structures in the front of the eye. And a very important structure in the front of the eye is the cornea. So the cornea is the front window of your eye. It's the clear, transparent, protective outer layer. And together with the sclera, which is the white of the eye, serves as a protective barrier against dirt, germs, or other things that can cause damage to the inner structures of your eye. Your cornea can also act as a filter, filtering out some of the sun's harmful ultraviolet light. So a healthy cornea is important for good vision, and for objects to be perceived clearly, lights needs to be focused on the retina, which is the light-sensitive bit at the back of the eye, and signals are then sent to the brain through the optic nerve to perceive good vision. So light is focused on the retina by two main parts of the eye. The majority, 2/3, is focused by the cornea, and a third is focused by your natural lens. So once again, there are many causes of red eyes, and the majority of red eyes are due to problems in the front of the eye. And the front of the eye is also known as the ocular surface. Together with the cornea, the ocular surface refers to other structures on the front of the eye that supports your cornea. And these include your tears, which is essential for a healthy ocular surface. In addition to lubrication and providing a smooth surface for good vision, the tear film provides oxygen and nutrients to the cornea. It also contains enzymes and proteins that help to protect the eye from infections. And healthy tears are comprised of a balance of three main components: a mucus layer, a watery layer, and an oily layer. So another component of the ocular surface is the conjunctiva. Okay, this is a translucent lining over the white of the eye. So it contains cells that secretes the mucus layer of the tears. And when you get red eyes, it's usually the conjunctiva, so this layer, the conjunctiva, that gets red. Another component of the ocular surface is the lacrimal gland, whose main function is to produce the watery layer of the tears. And the third, another important component of your ocular surface is the meibomian glands, which is found at the margins of your eyelids, and this forms the oily layer of the tear film. So remember, the tears consist of a mucus layer, a watery layer, and an oily layer. And all these components form the ocular surface. And a healthy ocular surface is important in preserving vision. So there are many causes of red eyes, which unfortunately I will not be able to cover everything today. But many of the common causes are relatively benign and self-limiting. However, there are some conditions that are potentially sight-threatening and may manifest as red eyes. So in this talk, I'll go through some of these common conditions of red eyes. And throughout the talk, I'll also point out whether the conditions are serious or not. And when I mean serious conditions, there are those that are sight-threatening. So firstly, this is very common. You see this picture? This is a typical presentation is a sudden onset of a bloodshot eye that looks like this in the photo. It's often not related to any cause and happens suddenly and spontaneously. And the vision is often not affected. This is known as a subconjunctival hemorrhage. And it occurs when one of the small superficial blood vessels bursts underneath the conjunctiva. And if you remember, in my earlier slide, the conjunctiva is a transparent, clear tissue lining covering the white of the eye. So this occurs when a small superficial blood vessel bursts under the conjunctiva. The blood has nowhere to go, so it spreads out underneath the conjunctival lining. There are many causes for subconjunctival hemorrhage. For the vast majority, the cause of subconjunctival hemorrhage is unknown. It can also be caused by rubbing your eyes or direct trauma or direct injuries to your eyes. Sometimes coughing and sneezing or straining too hard can result in this. For example, if someone lifts something very heavy, it's more likely to occur in people who are on blood thinning medications, for example, for heart problems, and also has been associated with high blood pressure. Although the bloodshot eye can look severe and scary, subconjunctival hemorrhage usually does not cause any permanent harm to the eye, unless it's associated with a significant eye injury. So unless the subconjunctival hemorrhage is associated with a significant eye injury, usually subconjunctival hemorrhage does not cause any permanent harm to the eye. Schedule an appointment with an eye doctor who will examine you and make sure that there are no other damage to your eye. They may measure your eye pressure and also take a look inside the eye. And if there's some discomfort, you may be given some lubricants or artificial teardrops. And if you're on blood thinning medications, there's often no need to stop your medications. Okay, we see this a lot also in the emergency department. The typical history is a short onset of a red, sticky, or watery eye. It may start in one eye first, then starts affecting the other eye. And often the vision is not affected. The individual may also be experiencing a viral infection or cold symptoms, such as a sore throat or having a runny nose. And there may be someone at home or at work with similar symptoms of red eyes or cold symptoms. And this is viral conjunctivitis, which is a viral infection of the conjunctiva, again, the lining on the white of the eye. So the main viruses that cause these typical this viral conjunctivitis are your typical cold viruses. And so it's more likely to occur when you have a cold at the same time, or cold or cold symptoms at the same time. The majority of viral conjunctivitis do not affect vision, and so they're mostly not serious. Schedule an appointment with your eye doctor who will examine you, and as there's a small group of people who develop a type of viral conjunctivitis that can affect vision. As viral conjunctivitis is contagious, remember hand hygiene is very important. Remember to wash your hands after touching your eyes to reduce the risk of spread. And don't share towels, pillows, and things like that. So cold compresses can help with the swelling. And your eye specialist may give you lubricant drops, and depending on the severity, sometimes antibiotics or even anti-inflammatory drops are given. Next, I would like to talk about eye injuries, in particular corneal injuries, which are a very common cause of red eyes. So a typical story is someone having an accidental poke in the eye, for example, with a finger, or where after removing contact lens, or maybe even the edge of a paper, or even after rubbing eyes. So the majority of injuries are known as scratches or corneal abrasions. And this is what we see when we examine the eye with a corneal abrasion. This is a special dye that we use that can show up the areas where there is no epithelium, as it has been scratched off. So there are 5 layers of cornea, and the epithelium is the outermost layer, or also known as the skin on the cornea. So if you see an eye doctor, you'll be given some antibiotics and lubricants. And although they can cause a lot of pain, these abrasions usually heal on their own within a few days without any problems with vision. However, more serious injuries can occur if there are deeper cuts, such as this eye, which has sustained an injury due to a work-related accident caused by something sharp. You can see that the object has made a cut through all the layers of the cornea, and this eye will need surgery to repair the cut, and it will not be easy to restore the original vision for this eye, as these injuries often will heal with a scar. Also, serious injury can occur with strong chemicals or heat burns, which can happen in people who work with chemicals or heat. So we always advise the use of safety goggles when working in high-risk environments. Any type of eye injuries can be potentially serious. So I would advise seeking medical attention with an eye specialist. So if you have sustained any form of eye injury, it can be potentially serious, and I would advise seeking medical attention with an eye specialist. So moving on to another common cause of eye redness, and this is dry eye disease. And this is also very common. So dry eyes can be due to a problem with the quantity of the tears, where the eyes do not make enough tears to stay wet, or a problem with the quality of the tears, where the tears are present, but they do not work correctly. For example, they dry up too fast. In dry eyes, the common symptoms are scratchy feeling like there's something in the eye, stinging sensation, burning, having red eyes, light sensitivity, blurry vision. But unlike other corneal problems or other more serious problems, the blurry vision in dry eyes is often intermittent, on and off. And this is what we see when we examine someone with dry eyes. And you can see these dry spots on the cornea and using a special dye. So anyone can get dry eyes, but you might be more likely to have dry eyes if you are older, are female, wear contact lenses, or spend a lot of time on the screen working on the computer a lot, where you sometimes forget to blink. And less commonly, if you have underlying autoimmune or inflammatory condition, for example, Sjogren's. The vast majority of dry eye diseases are not serious and do not cause permanent loss of vision. So the vast majority are not serious and do not cause permanent loss of vision. But having said that, there's a small group of people with severe dry eye diseases that are related to autoimmune or inflammatory conditions, which can potentially be sight-threatening. So what are the treatment options for dry eyes? For many, it is the quality of the tears that are affected rather than the quantity of the tears. Warm compresses can help to improve the quality of the tears. The most common treatment for dry eyes is a type of eye drops called artificial tears or ocular lubricants. And you can get these over the counter without a prescription. There are also over-counter moisturizing gels and ointments that may help your eyes feel better. And I've shown some here, but these are just some examples for your reference only, and they are not deemed recommended, as there are also many other types of lubricants. If you have something in your life or your environment that is causing your dry eye or making it worse, you may try some lifestyle changes to control your symptoms. For example, try to avoid smoke, wind, or air conditioning. Screen time can make your dry eye worse, as you might forget to blink. And so it's important to take regular breaks from staring at screens. Drink plenty of water to keep yourself hydrated. Lack of sleep can also cause dry eyes. And consider using a humidifier to keep your air in your home or workplace from getting too dry can also help. If your dry eye is more serious, there are other medications that are available that can be prescribed by your eye specialist, and some of these eye drops can help your eyes make more tears. Surgery is often not required for dry eyes unless they can cause problems, for example, with the eyelids that are causing dry eyes. Okay, moving on to one more condition, which is called keratitis. Keratitis is an inflammation of the cornea. And the most common cause of keratitis are infections related to contact lens wear. Although contact lens can provide many benefits of not needing to wear glasses, they are not risk-free. This is especially if the contact lens wearers do not practice healthy habits and take care of their contact lens and supplies. In contact lens keratitis, the symptoms are pain, redness, and light sensitivity, and there may be blurred vision depending on the location of the infection. Sometimes people can notice a white spot on the cornea where the infection is, like the one shown in this picture, these white spots, which are spots of areas of infection. If you suspect that you have a contact lens related infection, the most important thing is to stop wearing your lenses. Okay, the next important thing is to seek medical attention from an eye specialist. If medical care is sought quickly enough and early enough, and treatment is started, most complications can be easily avoided. However, more serious infections can cause more pain and even permanent visual loss, depending on the cause of infection and how long one waits to seek treatment. This is an eye with severe contact lens infection where there is a delay in starting treatment, and you can see that the cornea is no longer transparent. Remember, the cornea is supposed to be transparent to function well. And this is serious and will require admission to hospital for treatment. Keratitis can usually be prevented through healthy habits and proper care of contact lenses. And here are some tips. Always wash your hands with soap and water and dry your hands well with a clean cloth before handling your lenses. Water can also introduce germs to the eyes through contact lenses, and thus always remove contact lenses before swimming and avoid showering with them in your eye. Do not sleep in your contact lenses, as sleeping while wearing contact lenses has been shown to cause up to 8 times higher risk of infections. Lenses and cases should be cleaned properly, and remember to rub and rinse your contact lenses with contact lens disinfecting solution recommended by a contact lens practitioner each time they are removed, and never use tap water or your saliva, and never mix fresh solutions with old or used ones. Lenses should also not be overworn, and I would advise giving 1 to 2 days break in a week and not more than 10 hours a day. And there are different types of contact lenses, and the lowest risk ones are the daily disposable lenses, as you don't have to worry about cleaning or storing your lenses. Some lenses allow more oxygen through and allow your cornea to breathe. Colored lenses, such as these, increases the risk of corneal infections due to the material used to make these lenses. So they do not allow the cornea to breathe, and they are at higher risk of infections, are usually not recommended by eye specialists. So contact lenses should be fitted and dispensed by a qualified contact lens practitioner, and never prescribe lenses, for example, by buying over the internet or without proper fitting. So I've come to the end of my talk. There are also many other causes of red eyes, which unfortunately I'm not able to cover in my talk today, but I just want to highlight once again, although red eye usually goes away on its own, redness of the eye sometimes can be a signal of a more serious eye condition or disease. And you should seek medical attention with an eye specialist if your red eye is associated with pain, with one of these, pain or light sensitivity, if your vision is affected, if you have prolonged symptoms for more than a week or it's getting worse, your eye is producing a lot of pus or mucus, if you have fever or headaches, if you wear contact lenses, or especially if you have recent eye surgery or laser treatments. So if you have any of these with a red eye, it's best to seek medical attention. So thank you very much for listening. So please feel free to type your questions in the Q&A box.